Good morning to you all. It's my pleasure to welcome you to the NHE365 Virtual Festival. For those of you who were here at our first NHE event too, no, Roy has not undergone some kind of youthful transformation. Rather, I'm Matt, editor of our National Health Executive brand, and between myself and our fabulous team behind the scenes, it's great to see both so many new and returning faces. As ever, we've got an incredible lineup of thought-provoking speakers ready to share their insights, their expertise, and their ambitions for NHS staff health and wellbeing. Join us throughout the day, and all content from today's conference and from our previous events will be available to watch on demand. It's a feature that so many of you have already told us, who you found extremely useful, as we ensure the learning and sharing that we achieve today continues long after the event. Similarly, only together can we truly improve the welfare of our healthcare staff. So keep an eye out during the breaks, because there's plenty of opportunities to network through our meeting hub, or take a trip to the digital marketplace to learn more and access a host of interesting resources. But without further ado, because I think you've heard me waffle on for long enough already this morning there, it's my absolute delight to welcome our virtual stage, the first speaker of the day, Chief Executive of NHS Employers and Deputy Chief Executive of NHS Confederation, Danny Mortimer. The stage is yours.
Great. Thank you so much, Matthew, and thank you to the team for inviting me and for all of you making time today to come together and to reflect a bit more on this important topic. What I wanted to do was just offer some reflections on the context that we've been in relation to our workforce over this last couple of years. Talk a little bit about some of the particular issues that have emerged as a result of the pandemic, and then also talk about some of the things that we believe from talking with our members are particularly important going forward. There are people on the agenda today, particularly Neil Greenberg, who's speaking a bit later today, who'll dive deeper into some of these issues. And I apologise in advance for any duplication, but I also apologise for the fact that Neil will talk about one or two of the specific issues much more powerfully than I will. Listen, in terms of the context for our workforce, and I think it's important to kind of just step back and look at the overall context. Clearly, the pandemic has had a profound impact on the country and on health and social care. I think it's important to remember that impact in the NHS has been felt right across our services. We have many of you have rightly focused on colleagues who've been working in critical care settings, and particularly those massively expanded critical care settings that we've seen over this last winter. But you will know from your own organisations and from your own systems that the impact of caring and responding to the demand for acute care for COVID patients has been felt right across acute hospitals. Staff have been moved into new and unfamiliar settings. Care for patients has been enormously disrupted. But you will also know from your systems that actually the impact has been felt right across the health services. It's been felt in community teams. It's been felt in mental health services and ambulance services and in primary care. It's also, the pandemic, we know from talking to our members, has thrown up other extreme situations. An increase in safeguarding cases and safeguarding referrals, the mental health demand that we've seen being driven up as a result of the pandemic, the lockdown, and the economic downturn that so many families and communities have experienced. All of those things have also impacted on staff. And as Neil will talk about later today, there's also been this profound sense of moral injury. Staff have known for huge periods of time over this last year that they're not able to work in the ways in which they would normally work. They're not able to do things in the best possible way for patients. They've responded magnificently to the challenges of the pandemic, but that has meant compromises, whether it's around staffing levels or the way in which people work, that we never thought we'd have to make, and they thought they'd never have to make. I think it's also important to stress that before the pandemic, there was enormous pressure on our services and our people. That was particularly true because of the large level of vacancies that we're carrying. We entered the pandemic with 90,000 vacancies in the English NHS and similar relative figures in other parts of the UK. And we also, though, and these are things that we have to take responsibility for as employers, we also saw difficulties in our own workplaces, particularly related to race and ethnicity. We've understood in England for far too long now the differential and poorer experience of our Black and minority ethnic colleagues relative to colleagues who look like me and have had the benefits of being a white man working in the NHS. The pandemic magnified and exacerbated those challenges, but we need to be honest that those challenges existed long before the pandemic. And clearly now, as we emerge from the extremes of the pandemic, and as we feel the benefits of the lockdown and the better weather and the vaccination programme, there are serious challenges awaiting our people. We have a massive backlog of elective care. We worry that backlog will be even bigger because huge numbers of patients didn't come forward for treatment over the course of the last 12 months. We've seen the mental health demands that I've touched on already surging throughout the last 12 months, and over 40% of patients are now facing significant waits for mental health treatment. And we're also seeing a growing understanding of the impact of COVID in the longer term, the kind of post-COVID syndromes that are placing demands, particularly on primary care and a number of specialist services in other settings as well, as people rehabilitate and recover, but also find that actually long-term harm has been done to them and their functioning, and that creates an additional pressure for our services as well. We know that the impact of the pandemic in particular has impacted upon the mental health and well-being of our people. A large study in the West Midlands, over 2,500 staff, showed that 34% were showing real clinically significant symptoms of anxiety. And a similar study in London with 4,500 staff, or the best part of 4,500 staff, reinforced that finding. It also reinforced that younger colleagues and women were more likely to report those symptoms than others. And we also know, again, because of the pandemic, more broadly in society, that the disease, the virus, has had a disproportionate impact in people in our ethnic minority communities, and that's been reflected in our workplaces as well. And that similarly has taken a toll on people's physical health, of course, but also on their mental health and well-being. What we have seen through the pandemic from national leaders and from you is a significant scaling up of support. The area of health and wellbeing in the workplace has long been something of interest to employers. It's been an area of work for my own organisation, NHS Employers, for many years, and for many of us who've worked as HR leaders for the last 15 years or more, we've focused increasingly on health and wellbeing in the workforce. What we've seen during the pandemic, there were two things, I think, in particular. The first is a really significant national effort. In England, Prerna Issa, the Chief People Officer, members of her team, in particular Sonia Wallbank, who led on this area of work for many months, have provided really fantastic national support, access to resources and online technologies, access to counselling and support for staff at a scale that we've never been able to achieve before. And they really deserve our thanks for doing that. They've done some really innovative things as well in terms of targeted support for ethnic minority communities, really fantastic bereavement resource, for example, for members of our Filipino community who've been so badly hit by the virus. But at the same time, we've also seen that matched by a really significant scaling up of work that organisations have done themselves. Massive investment in resource and support for people. Charities, hospital charities and others have played a particularly important role there in providing investment to provide that support. And of course, the public have also been very generous in terms of their support for national and local NHS charities. And that's been particularly geared at wanting to support NHS colleagues, because there was that recognition, there was that groundswell of recognition for the astonishing work that colleagues were doing throughout the pandemic, and particularly at its peaks. Those local actions, and many of you will be familiar with those, it's been about creating physical rest and drop-in spaces. It's been about providing increased access to counselling. It's been about training for managers. It's been about looking at the financial health of people, particularly as their families have been affected by the downturn or by furlough. It's been about providing additional support to the large numbers of staff who've been been shielded. And people are looking also to work with their trade unions and their staff networks, and they've played a really important role in also helping kind of scale up that response. We published a report about 6 weeks ago, and in that you'll see some really interesting case studies highlighted. The report looked at the issues around health and wellbeing, and we've got 2 case studies in particular from Imperial Health, a large hospital trust in London, but also Birmingham and Solihull Mental Health Trust, which obviously operates in a very different way in very different settings. And clearly, some of the things that Imperial can do in a more community-based organisation like Birmingham and Solihull, that isn't possible. But different things have been tried and delivered that are fit for purpose for the settings that people are working in. Clearly, one of the questions that our members raise with us is, well, how do we sustain this for the longer term? And again, we've seen really important national action, I think, in regards to that. We've seen significant sums of money announced in October to provide investment in support to staff. We've seen the announcement earlier this year of 40 mental health hubs with an operating model designed very much drawing on the lessons that Neil Thwaite and his colleagues learned up in Manchester following the terrorist incident up there, and the support they had to provide to healthcare staff, but also to communities that were affected by that incident. And that, we say, is a really terrific step. And I know that employers themselves are also looking at how they can sustain their local actions. And again, their charities are often playing a really significant role in this. I think, though, there are some things that are remaining to be addressed or remaining for us to bear in mind. You will hopefully have heard the Confederation that I've been running for this last 6 months while we wait for our new chief exec to start, talk about the need for a recognition of decompression time for staff, of time for rest and recovery. At a practical level, that could just be people have got so much annual leave that they've very, very kindly agreed not to take over the course of this last 4 or 5 months in particular, but in many cases over the course of the year. But it's also about recognizing that given the experience that people have, given the profound changes people have had to make to their ways of working, we just need to recognize in this next period, over this next few months, that we just need to build back up our non-COVID services in a proportionate way. And that actually, longer term, we probably do need to recognise as a service, and our national leaders need to recognise that actually, particularly given the context of the vacancies, and I'll come back to that in a moment, we just need to kind of calibrate our expectations around productivity, about what it is people can achieve slightly more sensibly, slightly with a greater sense of proportion than perhaps we've achieved over recent years. And the expectations of our politicians are really important there, in terms of particularly how the NHS can recover the backlog of elective care that we faced. I'm old enough to remember when waiting lists were at this kind of level. I was a general manager in orthopedics in the late 90s, and I never thought we'd be back in this kind of position again. But it took us many, many years indeed, and significant investment to recover that position at the early part of this century. And our job on your behalf is to keep reminding the government of the need to manage expectations, including their own, around what it is the NHS can achieve, but also what support the NHS needs to achieve to deliver that. So that point about reset and recovery and expectations is really important. Clearly, the things that have been learned over this last 12 months around local health and wellbeing strategies and the way in which national work can complement and support what it is you're doing locally, that we need to find ways to sustain that. And again, I pay tribute to NHS charities and to NHS charities together in particular for the work they've been doing right across the country in that regard. There are some important things around recognition and reward. Lots and lots of you are providing that in practical ways through extra leave for people, but also through the leadership that you and your teams are providing on the ground, and a recognition that whilst the absolute peak of the pandemic has hopefully subsided, and has hopefully subsided for many years now, actually the impact is still being felt by people. And that ability to have leaders at the top of organisations, but also leaders on the ground that are creating the space, that are having the conversations, that are listening to what it is people are telling them is really, really important. However, there is also something about action that the government needs to take for longer term. We have coordinated a letter this week that went to the Prime Minister 2 days ago and that has had some coverage in the media today, which points out that the government must give people hope in terms of the long-standing vacancies that we face. Clearly, the government has taken action around vacancies. The additional medical school places were commissioned under the David Cameron and Theresa May governments. Mr. Johnson, when he was elected 16 months ago, committed to recruit more nurses and has changed the way in which undergraduates studying for healthcare degrees receive support during their study, financial support during their study, all of which is very welcome. But what we don't have, and what the government committed to do, was to have a proper workforce plan. Prerna and her colleagues have done fantastic work in terms of setting out some really important cultural and employment expectations about our workplaces, but what we don't have yet are clear numbers and a clear investment plan. And what we do say, and what our members say very clearly, is that actually staff need some hope that the government will back that plan, and we're pushing for that in this autumn spending review. I'll stop there now.